Hello, I'm Dr. Pamela Ruig. I hold the David J. Ellis Chair in Large Animal Clinical Sciences at Michigan State University. And in this video today, we'll be discussing a really important key performance indicator: how to use somatic cell count values to measure subclinical mastitis. Now, subclinical mastitis is defined based on having a normal appearance of the milk, a normal appearance of the cow, but an excessive number of inflammatory cells, somatic cells, in the milk of that cow. Those somatic cells have moved into the milk of the cow because there's a bacterial infection there, and they've been sent to engulf and destroy the bacteria. So the somatic cell count in the milk goes up. Now, it's interesting because sometimes we think when we see these somatic cell count values that they're related to the amount of clinical mastitis. But we have to remember, sometimes we can have millions of somatic cells in the milk, and the milk will still look normal and the udder will still look normal. That's why we have to measure the number of somatic cells each month in order to detect and define subclinical mastitis. Now, there's different ways that we can measure the amount of somatic cells or inflammation in the udder. But the most common way we do it is to use monthly DHI somatic cell count values. And that's what I'm going to be focusing on today. I do want to mention that there are other indicators, and that includes the California mastitis test or some of the biomarkers which can be measured using automatic milking systems. We'll leave those subjects for another day. Monthly DHIA somatic cell count values are the most common indicator of subclinical mastitis that we use. And they're so common that sometimes we forget that they measure the combined somatic cell count from all 4 quarters of the cow. Now, why is that important? Well, mastitis usually occurs in 1 or maybe 2 quarters of the cow. So the healthy milk with low somatic cell counts will dilute out the high somatic cell count milk from a single infected quarter. So when the combined milk, that monthly DHI somatic cell count value, exceeds 200,000, it tells us that there's probably at least 1 quarter that exceeds 800,000. So we have to pay attention to even these kind of marginally low values like 200,000 in order to find the cases of subclinical mastitis. Now, when we use the monthly DHIA somatic cell count values to find subclinical mastitis, most of the time our presence of subclinical mastitis is defined based on using a threshold of 200,000 cells per mil. That isn't an absolute value, but it's what I'm going to be discussing today because it's most common. And when we use that threshold, there's really 3 important key performance indicators that we can start with to help us define the amount of subclinical mastitis in the herd. The first key performance indicator that I'm going to discuss is the prevalence. That prevalence value answers the question simply: how many cows that we have somatic cell count values on this month actually have subclinical mastitis? It's calculated very simply. We take the number of cows that have somatic cell count values above our threshold, usually 200,000, and divide it by the total number of cows that have somatic cell counts that month. And our goal is less than 15% of the herd should have subclinical mastitis. That goal is based on reviewing thousands of herd somatic cell count values, so you can be confident that that goal is achievable. So that's the prevalence, less than 15%. The second question we often ask is, hey, how are we doing at preventing subclinical mastitis? And to answer that question, we can calculate the incidence. The incidence tells us out of how many healthy cows last month, how many of those healthy cows, cows with less than 200,000 cells per mil, became infected in the last month. And to calculate that, it's also very simple. We simply sum up the number of cows that have 200,000 somatic cells this month, but were less than 200,000 last month. That means we're only including in this calculation cows with 2 consecutive monthly somatic cell counts. When we calculate the incidence based on comparing somatic cell count values for 2 months, our goal should be less than 8%. In other words, less than 8% of the cows who were healthy last month should have increased somatic cell counts and have subclinical mastitis this month. The third really important key performance indicator will help us define the quality of our dry-off and our fresh cow programs. And that is, of the cows in their first month of lactation, what percentage of those cows have developed subclinical mastitis? That's calculated very simply. We simply take the number of cows that are at their first test, they're in their first month of lactation, and we count up the number of cows that have their first test somatic cell count over 200,000, and then divide it by the cows that are at their first test. This is an important measure of how we're doing with those dry and transition cows. And there's different goals based on parity of the cows. The cows that are older, second lactation plus, we'd like to see less than 15% of those cows have high somatic cell count at their first test. But we've got more stringent goals for the first lactation cows. For those cows, we'd like less than 10% of those animals to be high at their first test. All right, let's recap. To appropriately measure and manage subclinical mastitis on our herds, we need individual cow somatic cell count values. When we are measuring prevalence, we'd like to see less than 15% of the cows each month have subclinical mastitis and less than 8% of the cows that have 2 consecutive tests and were healthy in the previous month develop subclinical mastitis in the subsequent month. If you'd like to know more about managing subclinical mastitis, view our video series on that subject.